Good afternoon. I, Dr. Ranjurani Das, President of Northeast Chapter, ANEI, welcome each one of you to the first episode of Empower Hour of the year 2024, hosted by Northeast Chapter, which is focusing on engaging patients to prevent harm. Now, I request Madam Captain Ajita Nair, National President, to say a few words. Over to ma'am.
Thank you, Dr. Ranjurani Das. First of all, let me congratulate you for organizing this program, first of Empower Hour of 2024, and with an array of well-known people. And I'm sure it is going to create waves and discussions across the country, because we have people joining from across the country. And not only that, the topic of importance, Empower Hour, the story goes like this. It is the third year of Empower Hour. Every year we have this program done every month. So one topic per month related to patient safety. We had been having a similar program. So it is been going on uninterrupted. So we have had 24 of this prior to this. Okay, so this year is the first one. In January we are doing this, and the topic of this year is going to be how do we engage patients in our care, in our everyday care. And going forward, we have realized on a global basis that there is a need for engaging patients in all activities we do, especially in preventing or minimizing preventable harm which happens due to care in our hospitals. And all of us are on the receiving end. Not only the patients who are involved are also at the receiving end. I'm very, very happy to see the galaxy of people sitting here. We have from the other side of the spectrum, Mrs. Janabi Goswami. Very happy to have you here, ma'am. A formal welcome our Vice President will do. She is from there only, Dr. Unmona. And very happy to see Dr. Gunabi Ramdas. Welcome you. And I personally feel that the quality in healthcare happens when the treating clinicians involve themselves in what we do. And very happy to have you here. And also Mr. Rohit Upadhyay, Medical Superintendent of Marwari Hospital, Guwahati. And very happy to have all of you. And special congratulations to Unmona and her team, and also Dr. Ranjurani Das. And of course, I did not mention Miss Mary Anthony and Mrs. Bhavani Pegu. They are our team members. And thank you, Biji and Vinci and Dr. Aji for joining us. Vinci is our National Secretary, and Dr. Aji KL is our National Treasurer. So all of us are here. And over to you, Dr. Unmona. And this is, I know it is a defining moment in our life too, where we are openly admitting, the patients, and we are willing as a hospital team, we are willing to tell the patient that, hey, we are here to listen to you. So this is going to make all the difference in patient care. When they trust us, a lot of things can be sorted out. And wish every one of you all the best, and sincere thanks to all of you. And over to Dr. Unman. Thank you.
Thank you, ma'am, for your valuable word. Now, I'd like to invite Madam Dr. Unmona Borgahai Saikia, Vice President, ANEI, and Coordinator of Empower Hour, to start today's talk show. Over to you, ma'am.
Ranju, can you hear me?
Yes. Yes.
Good afternoon. Our officials, Madam Captain Ajita Nair, President of ANEI, Secretary Vinci Trivandrum, and also Captain Aji, National Treasurer. And ladies and gentlemen, wish you a very happy and prosperous New Year 2024. I'm here to take you to a new version of Empower Hour. It's not a panel, not just a webinar. It will be very interesting discussion and which is named as talk show. It will be entirely patient-centric and experts from healthcare industry will reflect the patient's issues in 360-degree mirror. I'm sure that this talk show will be instrumental for ensuring prevention of harm for patients. So here the theme, engaging patients to prevent harm. Before the show begins, I would like to put up national officials and founder national officials. Next. So we are here having already all are present. Fortunately, our all national officials, Captain Ajita ma'am, Vinci, and Aji. I'm so fortunate, and I'm the vice president for current year. And the founder official, I must take the name of Ms. Thankam Games, founder president, Juti Clara ma'am, vice president, and Subhara, who was there as a national treasurer too. So I must say here that founder president of ANEI, Madam Thankam, had incredible 2 years of Empower Hour. With her blessings, I'm here to take forward this Empower Hour flag. So here is the list for the entire year I'm putting forward to you, that we are starting with the first from ANEI chapter. Can I have the next slide, please? Not moving? Next slide. Oh, it's not moving here.
Unmona, you are mute. Unmona, you are mute, and slide share has to happen.
Okay, so I was talking about that the entire year that we have planned, that starting with the Northeast chapter, next the Punjab, then Tamil Nadu, then Kerala, UP, West Bengal, Jharkhand, Haryana, Delhi, Telangana, Jharkhand, Haryana, Delhi, Telangana, Karnataka, and Maharashtra. This are the list. So, can I have the next slide now? And we from Northeast chapter really privileged, and thank you to Madam Ajita for consenting to start with the Northeast chapter to have a new beginning of Empower Hour 2024. Members for discussion today, we are very lucky to get consent from eminent people, particularly the who will be in the role of patient, Ms. Jahnobi, who has long years of experience as patient, also advocate to patient. I'm sure her experiences and views will throw light to us for better care in the healthcare management. And we are looking forward to hear you and your challenges. We also have a very busy doctor, but he has consented us, Dr. Gunaviram Das, Associate Professor from Department of Surgery, Assam Medical College Hospital, Dibrugarh, Assam. And we have Ms. Bhavani Pegu as academician who is lecturer of BSc Nursing College, Dibrugarh. And Ms. Mary Anthony, Nursing Superintendent of Downtown Hospital, who has a long years of experience, both education and service, also in the quality. And Another person, very important person, Mr. Rohit Upadhyay, in the administration responsibility, who is the medical superintendent in Marwari Hospital, Guwahati. I welcome you all to this talk show to have a great kick and new beginning. Yes. Now, I just want to start the discussion without further delay. Meaningful engagement of patients, families, and communities can improve healthcare quality and patient safety. Yes, definitely my first question will be to Jahnavi. And particularly, I did not talk in detail about Jahnavi. Before she answered the question, I'll be expecting you to give your brief introduction as a patient and however way you want to introduce. And then we will be willing to hear from you how a patient's own initiative or involvement can make a difference in health service. And maybe along with that, if you want to answer, I also listing down at the same time, what are the challenges you are facing? What are the barriers you are coming across in expressing your rights as patient? So looking forward to hear from Ms. Jahnavi. You can stop sharing.
Good afternoon, everyone. And
Good afternoon.
Numanaba. It's been long to seeing everyone's especially in Numanaba. And Happy New Year to all of you in the committee. I am Jahnavi, living with HIV last 30 years and working for HIV field almost like 28 years now. Basically, I am looking for the treatment concern for HIV positive people and the human rights issues for people living with HIVs. And also, I'm doing the advocacy purpose for giving the proper rights and proper information to HIV positive people across the India. Basically, I'm sitting in Guwahati. In Guwahati Medical College Hospital in JMCH, but being as HIV positive people, I work in a national level that we have an organization called National Coalition of People Living with HIV. It's called NCPI Plus. I'm a member of there. And also, I am representing Asia Pacific as a board member of Asia Pacific Network, based on Bangkok and one part in Singapore. So that's my things. But being as a person, so what I feel that all the hospitals should be for patient-centric. Many of time I have seen that doctors, even the nurses, even the counselors, they are putting their thought. Even the GMC also, I'm working in this place, I'm singing this, the people are putting their thought. And very few people that think about the patients. What patients is required, what patients is mind, because treatment isn't one kind of therapy, I can say. It's not because of the medicines people can get out of the disease or something. It is only because of how we treat them with a friendly behavior. That is going to help to improve their health. So it's my request to everyone, it should be patient-centric center in every hospitals, and who are also working in these hospital sectors or working with the patients for a long time. Because if I give my example, about HIV, if I'm not getting the proper counseling and proper peer support is one of the most important things for long-term disease like HIV, cancer, diabetic, hypertension. These are the people is required some kind of peer support. Until and unless people are not getting the peer support, the person will not overcome from there. So every hospital should make it one group for the peer support. That's my request to everyone. At least one peer support group, one support group meeting is going to be happen in the each and every hospitals with a group of persons. It will motivate one persons to others. And the second and third thing, like many of them are the below poverty line who we are work. Even that India is not a high income country, we are the middle income country, and where the people are most of the poor and poorest, and some people are the middle income. So for them, actually, if you could make it some kind of support system that fundraising or co-funded, like if people are required some kind of treatment or support, that can from the crowd fund, from the hospital authority, it can be helped. Because for the doctors and for the nurse and for the counselors, we want my clients should be live healthy and without any complaint. So that need to be there, and that's need to be on place in every private or government hospital. That's I want from your side at least, and I can take up these steps like that support group meeting or peer support group from each hospital can mobilize, and that will be helping not only the patient, that will also help the entire hospital authority. The person can say, okay, my patient is recovered. My patient is recovered. That is the main thing. If I see the people who are on the chemo in the last stage, and the person is coming after 4 or 5 years, like no, they are in a third degree chemo also, the third step of cancer also. The person is coming overcome for the situation, and they are living healthy for the long. It's only because of the cancer having their own support group meetings. And also for the old days, same thing is in old days, that the old age club and laughing club, that will also helping us. Not only we are believe on the treatment purpose or prescriptions, I also feel that some kind of yoga and meditation, some kind of therapy that which is called an extra therapy for them, where improve their mindset, that need to be included in the treatment curriculum. If I give it my example, like I was living with 30 years before in HIV, and that time there is no treatment is available. And there's no counseling system, no treatment center. There's a lot of discriminations in the society as a whole. But after all these things, I overcome because I got the good peer support. That's why I'm today here. And now I am on treatment. That's a different thing. And many people are on treatment in Assam, almost like 15,000 people are on treatment, but that is a different thing. But thing is in that, like, no, that these people are getting the peer support. The diabetic person, they have a peer support, but that need to be make it some people has to be like, no, make it their own centric, and they can make it the group where People can talk easily, people can be comfortable. That's the things we need it actually. I know that NI has doing such kind of things like like they're talking about the person centric. That's why today there's a first meeting is conducted, and they are contacted me for this for valuable topic. I don't know how much I can able to cover it, but yes, I want the every hospital, every nook and corners from the India, they think about patient's mindset and the proper counseling system, because counseling is one of the most important things for the treatment.
Meeting ID and password. 82724195.
Mr. Hussein, please mute yourself. Mr. Hussein. Yes, thank you.
Okay. So three things I want. One is a patient-centric, the hospitals for like private and the government center. The second, the proper counseling system should be in the place. And the third thing, there is a peer group, each and every hospitals with some extra curriculum, which it are like yoga and meditation should be included for the patients. And definitely other things also important for treatment purpose. Whatever doctors is prescribed, that definitely we need to do it. But along with this, if we do like some kind of this type of things, the three things will be, if it is in the place, definitely we cannot say that people will die soon because of these reasons. So love, care, and affections, it's come with the peer supports, and also it's depend on our behavior and our character. So with this, I won't take much time because it's my office time. A lot of people are on the queue. They are waiting for me to meet me. So if any kind of questions, if you want to ask, if I missed it, then you can ask directly because I will be here next 15 minutes for you.
Okay.
Thank you, Manava, for inviting me. I won't able to talk much because it is hospital duty times. So it is for difficult for me to be here for long time. Yes.
Yeah, I, as you are saying, you are in very rush period. I have only one question to you.
Yes.
I know it is the life you are dealing. It is really incredible to you and salute to you. And the way you are guiding and leading others and running also at a positive, the children's home, that is wonderful. And particularly the how did you overcome just one instance or one your characteristics or quality that I understand being the positive person, HIV positive person, like the challenges that you had overcome. What made you so that the way you are doing? Your courage. How you are
thank
getting
you,
your courage?
Thank you, Abanaba, because today I'm here because of my mom and my sister.
Okay.
Always I'm telling the same things because she is my courage and she is my backbone. My mom says, I don't want to see many more Jahanabi like you who have suffered from HIV or victimized from through HIV. So after that, I decided I should work for my mom because she loved it and she wants to be my backbone, and she's forcing me to work in this field. And my sister always is supporting, still she is supporting, and she is saying, yes, Didi, you can do it. Yes, Didi, you can. So that's the support, and also from my villagers where I belongs to, because I belongs from Nagaon, and the small village is called Kampur. So I belong from there, and they also supported me. Like, they are never discriminate for this about my status actually. And after that, when I started walking one by one day for another day, I feel that okay, I can walk. Now, when it becomes for my mom's wish to when it comes my wish, I cannot say that. It is very difficult for me to say. But regarding my work, yes, I have a one orphanage where 34 children is in there, and all 34 children is living with HIV, and they are orphan. The organization is situated, the children home is situated in 6 Mile in Surusnagar. Anyone can come and visit anytime. That is one. Also, our organization, as you see, my background is in like ANP plus, the Assam Network of Positive People. The organization worked for HIV positive people, by the HIV positive people, to the HIV positive people. It's called like people who were running these organizations, like me and my friends who was living with HIV for a long time, or many of are very new. And we are working for HIV positive people. We are supporting, giving support for counseling and human rights issue. That we have advocate, we have doctors, we have counselors, we have peer support group. They all who are working in my office, especially our organizations, all are living with HIV, started from driver to peer support inserts. All are living with HIV, because sometimes we feel like now when one person is become HIV positive, they're thrown out from the job. Still there is a going on. That recently, I don't want to mention the name of the hospital, that some staff suddenly become positive, and that hospital, they refuse to take them as a staff. They're thrown out from their jobs. So these things didn't happen, but we fight that. We fought the case, and we about to win. So our organization basically work for HIV positive people and their human rights. And today I am here because of my mom and my sister.
Thank you so much, Janobi. Only one last question you can answer in a sentence even. Like, what is your expectations? I have seen that some doctors, even the nurses, when they see the patient, positive patient, they do not come forward, like, and now we are taking the challenge, the patient's rights to be fulfilled here, that we have to prevent the further harm to them, and we have to put him in the center. So what you as a patient expect from us, from the doctors, nurses as a whole, you can say in a line or like, whatever.
Yeah, Baidu, I want the patient's rights is a human rights for everyone's. If person is living with HIV, or person is living with diabetic or the hypertension. So it's my humble request to everyone that the doctors and paramedical staff or nurses, they should treat patient with the respectfully, with love and care. If you see the HIV, we have a HIV Act 2017. In 2017 HIV Act, they says if person is living with HIV, and because of their status, doctors and nurses and paramedical staff or hospitals refuse to take the treatment, we can file a case against them. That is there. But as a doctor also, they have a
You are not audible.
full rights to refuse with safety. So I want, if I say being as a patient's view, I want Doctors should respect me. Doctors should give the proper treatment and proper guide to each and every client for equally. It's equal treatment for all. I want the equal treatment for all.
Thank you so much, Jahnavi, that your line really touched my heart. Patient's right is human rights. Irrespective of disease, irrespective of diagnosis, that each patient that we have to consider, they are human, their every right need to be fulfilled. Thank you so much, Jahnavi. And now I'll be moving forward to our doctor. As we know, there was a time doctor was only God. Whatever decision taken by the doctor, that is being considered as the best decision. But I see now trend is changing. Then lot of patient focus, lot of patient views, lot of patient interest and options are there. So I would like to ask Dr. Das, like, how do you think, what is your say on engaging patients for preventing harm? Many times we cannot engage fully, and we are not getting indulged in this culture that engage patient for their treatment. So what you say, Dr. Das? We are eagerly waiting to hear you.
Thank you, Dr. Unmana.
Yes. I think you are not audible. I am not able to hear you at least.
It's not audible.
I can't hear you.
It's not audible. I can't hear.
I think you can hear me now.
Yeah, we can hear now.
Yeah, yes.
Okay. Yes. Madam, can you repeat the question once more? No, you are muted now. You are muted now.
Engaging patients prevention of harm. Many times, like, we do not engage what the culture I am seeing now. Doctor decide everything, the treatment protocol is this, is that, and because you don't have much time, you just come and what you see, what diagnosis is made, then you make a list of treatment and you ask to follow. But this trend is going to change. Patient option, patient interest need to be focused. What do you say on this new trends?
Absolutely, madam, absolutely. The patients have every right to know what the disease they are having, what sort of treatment they will be carried upon, or what investigations are to be done. So for this, actually nowadays, this is a double-edged sword. I mean, it's good, very good. The patient should know everything. But the other point is that with due respect, many a times we face a lot of trouble, like the patient has gone into Google, has done a lot of research on that, and there has been some misinformation either from there or from some other sources, like some relatives or somebody or something like that. So this is something that bothers us. But I definitely agree that we as doctors should give utmost importance to the patient, and we need to understand what they expect from us. We have to understand that there has to always be a part of empathy in our treatment. And it is not a patient that you can see a patient in 5 minutes and give a diagnosis order. It is always, I always believe that we should explain the patients. I even open up the computer and show them all the diagrams, because a picture speaks 1,000 words. So if that is possible, if you have a book there or whatever, any schematic diagrams on and off there, so those can be used. And the patients should always, on our part, there is one more thing that we find is that the patients, some surgery is done long time back, or say 3 years back, but the patients do not come with those investigations. So the patients need to bring those investigations, the patients need to bring those reports, and give the most important history. They should not be, nothing should be hidden from the doctors. Does that answer your question, madam?
Yes. Yes, yeah. Like, what I said about, like, yes, due to the short of time, lack of time, like happens of not, listening properly, don't mind, listening
Yes,
in
yes,
detail
yes.
of the patient's options and no discussions that you want to go for plan A or plan B or plan C. What the surgeon decide or what the doctor decide, that's it happen. Okay, so like we really need to change now because the patient's right that we have to fulfill. So anyway, thank you so much for
Thank you.
answering this. I hope you'll remain.
Yes,
And
I'll be there.
yeah. So now my question will go to the hospital administrator, Mr. Rohit. As hospital administrator, you have to ensure the quality care to the patient. And what are the issues particularly you face as we are talking about the putting patient in center and patient engagement of the patient, particularly in maintaining transparency and valuing the patient's rights? Yes, every time, like one side I say we have to give the weightage to the patient, listen to the patient, go according to the patients, but there are also some restrictions and some difficulties and some challenges to do it totally. Okay, so can I hear from you if you are coming across anything such?
Yeah, thank you, madam. And I thanks the office bearer of ANEI and especially the Northeast chapters who has given me this opportunity to share few thoughts or the experience which have come across in my day-to-day administration. See, a hospital, once the patient comes to a particular hospital or a doctor, they come because of the trust. First most thing, once the patient comes to a hospital, that is the trust and the confidence the patient have with the doctor as well as to the institution where he is choosing to avail his medical treatment or services. For gaining the trust, hospital have to do a lot of things. Even the doctor have to do a lot of things. The commitment, the empathy, the confidence the patient should gain. It is not hospital should able to give. The patient should gain by virtue of different activities or different the program that hospital take. Firstly, if you are talking about a hospital where patient comes, there should be enough material for patients' educations, and the staff should be empowered. Staff should be well aware about the patient's right and responsibility. Each patient have their own rights. That rights, many of the hospitals they display the rights, but thing is that they don't educate their own staff who are actually on the ground, including your security guard to the reception. And each stay patient should be counseled. Suppose before admission, many of the times what happen, patient goes to a particular doctor, they ask particularly how much the cost of the treatment. So many of the times cost of the treatment because of the fear or something, the doctor may also underestimate the treatment cost and they give the less estimate. And at the time of discharge, there is always special. Doctor has told me this much and now your bill is coming this much. So for this, the counseling of this for patients should be done by some other third party, maybe the billing person or maybe the reception person who is independent, and he should get the input from the individual doctor who will be treating the patients. And most of the counseling should be done under audio visual system so that everything is recorded. So I had seen during hospitalization or at the time of discharge, normally patients, their own relative, their own guardians does not do any problem. But the third person, like Dr. Das said, third person, sometimes they go to the Google, sometimes they go to the some other areas and they try to create some of the nuisance at the time of discharge or during hospital stay also. It becomes very difficult for us to manage the situation. And they nowadays it is very easy for them to say you will call media. They think media is the solution givers for every problems. They give the threatening of the media to hospital as well as the hospital administrator. And see, for having the system process in place, we must follow certain quality standards in hospital, like as in either NABH or JCI or anything, any standard may not be accredited hospital, but the certain standards must be followed. So that in standards, some of the things we must maintain, like as in we say we whenever we wear a helmet, two-wheeler, we say it must be ISI certified helmet we should wear, nor it have extra safety layers in this ISI mark. Similarly, if a hospital follows certain protocol, SOPs or standards, there is additional safety on that hospital. And transparency, when we're dealing with the patients, we must be transparent. Many of the times it happens, if the patient party asks for the report, if the patient is admitted, if they want to get second opinion, or if they want to get second opinion from outside or within the same premises from the second another doctor, we should not be hesitant to share any report transparently. Whatever the findings are there, many of times we give them in writing regarding the actual condition, clinical condition of the patient. If they want to get it second opinion from any of the city or any across anywhere, they should able to give. They should not be treated they should not feel there is something they are hiding from me, my patient's condition is not properly explained or something. It should not be like that. Transparently, we should share all the report. We should explain them regarding the prognosis on daily basis. Normally in hospital setup, we face what happens. Some of the critical patients, they happens to go to the ICU and intubate and other things. We call the treating consultant as well as the in charge of the ICU in front of us, along with the patient attendant, guardian. We call them and counsel them, explain them regarding the total findings of the patient. Everything we explaining. Almost 4 or 5 people team, we make a team and we explain them so that their all doubts are clear. Because many of the times in hurry or in the short of time, we are unable to explain, or they are unable to ask the questions as they desire. They may feel the hospital authority or the doctor or the people who are treating me, they may feel offended or they may feel something. So we should give enough opportunity to the patient and patient family to clear all their doubts. Whatever they have, they must have that clarity while undergoing the treatment and we should be we should empower them to take decision, because in NAB standards and other things, there are a lot of objective elements where we talk about the empowering patients regarding their cultural belief, regarding their spiritual belief and their confidentiality. All those things we must take into consideration while taking this kind of. Few days back, I met one of the gentlemen. His father was undergoing treatment in one of the metros, not in Guwahati. So he told me, the doctor, his father was 96 years old. The doctor told him, we are treating you and your father need intubation. The person is from the engineering background. He said, okay, do whatever you want to do to my father. And later on, he said, intubation ka matlab to it was, they were trying to put my patient in the ventilator. I was not known the term intubation. They could have told me ventilation. So the jargon, the terminology which you use, so it must be understandable to the person whom we are communicating. Maybe in their own language, they should be able to, in the regional language. So they should able to understand, or they should able to receive whatever we want to communicate to them. And regarding second opinion, I had already told you, second opinion, they should be given enough opportunity if they desire for second opinion. And regarding this, any kind of complaint or any kind of violation related to the patient, there should be mechanism in the organizations to address this kind of violation, like then breaching the privacy, confidentiality of the patients, discriminating of the patient on the religions or their cultural belief. Those should be, there should be a mechanism to address, and preventive and corrective actions should be taken by the organization from time to time. And since we know hospital is a trial and error industry, there are a lot of error happens because most of the JCI accredited hospital, they project their errors or they project their accident report. Even though NAB is accredited hospital, they have to project their reports or how many incidents and accident happens, and along with the root cause analysis, so that prevention can be done in future. And that communication to the patient is very, very important. as I said, communications, they should not feel that there is anything hidden. They should not feel there is anything hidden from their side. And
Okay,
for
Mr.
that, yeah.
Yeah, very nice to hear you. The particularly very salient point you mentioned about that, particularly in the private hospital, about the cost. Transparency is the cost, and transparency in the cost, like yes, the trust will develop when we become more transparent. As you said, the trust is required. And something else also I liked it that you said the counseling with the audio video records. That is wonderful. And yes, like joke apart, like I thought the helmets used to wear just to get escape from the police so that no need to pay fees. And today I came to know not only wearing the helmet that it should be ISI mark. So we the healthcare provider, we should be very sensitive about whatever quality, whatever care we provide, it should be ensure the 100% quality. Yes, error can happen, but our plan prevention should be as strong as that, as you said. Thank you so much, Mr. Rohit. Yes, I want to say, don't build a house without its foundation, and don't build a hospital without nurses. Nursing leadership, it's not a position. It's more than a mindset. It's the way of being. So, Miss Mary, you being the backbone in the healthcare team, what are the vital areas nurses need to focus to engage the patient for prevention of harm? How can it be also done? Can I hear from you, Miss Mary?
Thank you, ma'am, and thank you for this platform. First of all, no doubt patient engagement is going to be the blockbuster therapy in the century. Many of the researchers do say that. And nurses being 24 hours with the patients, they are in an ideal position to come out with strategies where they can engage the patients and families to prevent harms. So I would like to focus 4 areas where we engage patients and their families to prevent harms, not only during hospitalization, but also preparing post-discharge. So first and foremost, it is medication strategy. Without engaging patients or patient's family, no patients would be able to take their medications right. So lots of techniques that we have started. First is that when the cash memos are printed out in our hospitals, we usually have the generic name coming out together with the cash memos. And even the generic names are also in the system portal where we indent medications. And we explain the patients and attendants that this is the same composition with a different brand name. So they are involved and many of the doubts are cleared during the hospitalization process. That is one technique. The other strategies where the nurses are involved is, if you see the discharge summary where the medications are written, when they come up post-appointment, lots of the patients, they keep on scribbling, they keep on writing in their own words how to take a particular medication. So we have come up with some my medication list where the nursing team together with the patients come up with a medication list. This is the medication with the generic name. This is the dose. This is what it is used for. And this is how you must use it, when, how, and how much. So that's a medication list. The other strategy is regarding a brown bag review. Like we encourage the patients, we prepare them, we teach them that when you come for appointment post-discharge, bring your entire box of medications. Many a times, the medication is written by the doctor, it is dispensed by the pharmacy, it is taken by the patient. The brand names, the generic names are very, very different with the compositions. And if you take a review of the brown bag reviews, out of 10 to 15 medications, only 2 brown bag reviews are accurate. So this is one system that can be implemented, and it is being done by the nurses. The other area where nurses focus is the bedside shift report system. So when we encourage nurses to give the bedside handover, they usually say that it is time consuming, and then, but no nurse have come back saying that bedside shift hand report has not helped them. There are many informations where the patients and the attendant give us more accurately. Like, for example, a particular nurse has by mistake spelled out that there is a blood group which is A, but the attendant corrects and says that no, it is O. So we again have a
cross-check of the particular blood incompatibilities, or sometimes it is also of a particular report which may go wrong during the handover. So bedside shift handover is also one technique of reducing harm for the patients and families by the nurses. It also gives a sense to the patients and attendants that we have done this and this is the next to be done in the next few hours. Next most important focus area is discharge planning. Discharge planning, each hospital must come up with a discharge bundle. Because when patients are getting discharged, they are happy to go home. They are having mixed emotions, like how will I be able to take care of the patients? We have to describe them the life, what is going to be after discharge. Lots of dietary restrictions, lot of activity restrictions, and how the life is going to be. If a patient is going home with a catheter, if a patient is going home with a nasogastric tube, we have to educate the family and prepare them. The most important thing is the teach back technique. We teach them and we ask them to teach back to us so that they understand that we understand and we understand that they have fully understood it. That is the teach back technique. Another thing regarding where the nurses can focus is regarding encouraging the patient to involve in decision making. That is what Madam Janabi Goswami has shared, that the healthcare providers like to put their thoughts onto them. So I think so this concept is changing nowadays. Patients and families want to get involved in their care. They want to know whether intubation, if at all required, can it be deterred, whether they can be involved in the decision making. Also, we had a particular patient who was hesitant to tell the particular primary surgeon that one of his residents, whenever they do the dressing, he gets pain. So he preferred a particular resident to do the dressing. Very small things, but it gives comfort to the particular patient. Other thing, encouraging the patient in shared decision making is a very simple example is when we encourage patients to go for air mattresses to prevent pressure injuries. Many patients and attendants do say that it is very uncomfortable sleeping on an air mattress. If anyone has slept on an air mattress, it is not so comfortable when you sleep on top of that. But when we show them the various gradings of pressure injury, then they become involved. And then those attendants who are involved to prevent pressure injury, we see that there is no pressure injury developed in those patients. So I think so these were the 4 areas that I wanted to deliberate where the nurses could be engaged in preventing harms. Thank you, and over to Umana ma'am.
Wonderful, Mary. So beautifully you mentioned all these points. Every point that you have stated, it is the point to remember by young generation. Thank you so much, Miss Mary. Be there. And now I am coming to another speaker, I can say the participant. So nowadays, very often I hear that teaching of young generation is a great challenge. They are either too smart or they are not up to the mark to be emotionally balanced, particularly to deal with the patients. So, Ms. Bhavani, what are the strategies will you adopt to sensitize this young generation and to appreciate the values of patients in healthcare delivery system? And I wish to hear from you this question. I'm also waiting to hear from you the key points that we have discussed that at the end, what the young generation can take from this discussion. So Bhavani, over to you.
Thank you so much, ma'am, for the question. Thank you so much. And thank you to this ANEI platform Northeast chapter for giving me this opportunity. Am I audible?
You are.
Okay. Yeah. So first and foremost, we have to instill this idea to our student that patient comes to the hospital. Why patient comes to the hospital? So patient comes to the hospital for treatment, for their well-being. And hospital is like a place where a team of experts work together a team of expert work together. But in the hospital, everybody that moves in and around the patient are not an expert, because if we see students, those who are regularly taking vital sign assessment or history taking, and all those students may be in clinical CCU scenario, ICU, or it may be ITU, or it may be general ward or OT scenario, wherever it is, we have students and we do not consider the student as an expert. So, but whatever it is, as they are the team who are acting or who are playing a role in the hospital scenario. So even an error that seems to be tiny, this tiny error can also lead to a huge consequence. So this concept, we have to make the student understand first and foremost that they are working along with a team of experts. They are not the expert, but even the slight mistake from their part can lead to failure of the whole effort of the team of experts. So even a tiny error can lead to huge consequences. So this idea we have to we need to teach to our students. And I feel that as like students are today's student forces are tomorrow's nursing workforce, and because of that we really need to help our students to develop a good theoretical knowledge base, because we many a time we see that due to the lack of this poor knowledge base, they cannot take decisions, or they have difficulty making decisions, or also they have like problem in like a lot of problem in the healthcare while delivering healthcare procedures or whatever. So we have to give a good knowledge base to the student. And while giving this, I think we have to instill the idea of patient safety right from the beginning. At the time of like teaching foundation of nursing itself, we can start right from there, and gradually it can be like promoted to instilling the concept of safety in specific population or specific disease population or patient population. So we can upgrade it like that way. And I also feel that case study can be very important here. We can incorporate case study actively in our teaching scenarios. Case study with unfolding scenarios. Here what can happen is like we can take a complex scenario and we can bring it up to the student, gradually unfolding the scenario so that students can use their knowledge they have already learned, the theoretical knowledge, the skill that they have learned in their lab, and using this knowledge and skill and competency in making the decision, in making the right decision for their patient, not forgetting the concept of safety once again. Then I also feel that the most important part is after developing this knowledge base, they have to develop their practice base. So to develop this practice base, this is the real challenge, because right after learning, they have to move into the clinical scenario. So nowadays we are using this simulation concept. In the simulation concept, they are getting this real life, this one real or actual scenario. It is not the actual scenario, but it is nearing the actual scenario. So here students can learn with errors and they can practice rigorously. And after practicing this, I think they will be comfortable enough to work in an actual scenario. Even then, we cannot say that students will be comfortable here, because the actual scenario can be very much like dynamic and it can be unpredictable. So here the students may become confused and they may not be able to perform well. So here I feel that there is a great role between the nurse practitioner and between the nurse academician. I feel that there can be a collaborative interest between these nurse practitioners and nurse academician. We all can have a common interest. We can have a common language regarding what we can expect from our student. We have to instill this idea once again that like the safety is the core competency that we expect from our student, and the same thing it is their main objective while performing their duty. So this we have to keep in mind. And also like I already said, between this collaboration and also the feedback system is very important, because only the feedback system helps them to analyze their set of actions that or the set of behaviors they have shown in the actual work area. And the main thing is not just delivering care, but continuously improving care. So it is the right procedure at the right time, towards the right person, and it has to be done every time and for every patient, and it need to be a regular practice. Then I also feel like keeping in mind the discharge. So we have to keep in mind the discharge right at the time of admission itself. This we can teach to our students, I feel like that. And also the importance of communication, clear, concise and direct communication strategy. So I feel so these are some of the area where we can And
Absolutely.
yeah, most importantly, one more point I missed that. Many a time we see the lack of assertiveness among students, lack of assertiveness. So though we say that young generations are a lot assertive, but we see that mostly it is they're emotionally assertive rather than being professionally assertive. So to be professionally assertive, again comes the importance of knowledge base and have the good practice, the good skill and like good decision making. Only then they can be professionally assertive. Otherwise, we see that many a time students they observe errors in the hospital, they observe potential errors, but they are scared to speak up because might be they are not sure, or might be they are not confident enough about their own knowledge, or maybe they are scared of the afterward consequences that can come up later.
Okay, that's great, Bhavani. Nice to hear you. I'd like to ask you, like, as your teacher, you're going back and talk to your students again. By listening to the other speakers, I want from the each speaker what you have been picked up and what you are going to tell to your students.
Yes, ma'am. I have noted down, and I feel that the eminent personalities they have really given great points, and I have noted down the points. I would like to highlight few of them. So our patient Jahnavi Goswami, madam, she has really given one important point, that is the care need to be patient centric. So here comes the actually we already teach our student regarding therapeutic communication, but maybe we need to strengthen this, re-strengthen this, and reinforce this learning,
Okay.
because therapeutic communication itself means communication which allows the patient to express their emotions. It is not based on ourselves, but it is directed towards the patient.
Yeah, she
So
also
this
mentioned about the
patient-centered.
peer support. Yeah, peer
Yes,
support.
ma'am. She also mention about the peer support group and also proper counseling system and incorporation of, I think, complementary and alternative medicine, which I have written in my own language. So I feel incorporation of yoga and meditation, because many a time the body heal, but the mind does not let us heal. So
Exactly.
maybe this point we need to give importance for the future learning.
Okay.
And Dr. Gunabhiram Das sir has said like patients are advanced nowadays. They come like they learn from the Google whether they're coming with the correct learning or whether they're coming with a wrong learning. But we need to give importance to their need for learning, and also in the healthcare. That means altogether we have to improve the healthcare literacy among the patient. We have to teach them right from the beginning. It may be a little bit this one chaotic, or it may seems to be a little bit burdensome, but this is
Okay.
important, keeping in mind the patient's right aspect.
Yeah.
And as patients are very concerned about healthcare expenditures, as said by
Right.
Dr. Rohit Upadhyay sir, yeah. So as patients are very concerned about healthcare expenditures, the concept of cost effectiveness and the cost efficiency comes here. So the students need to learn, their aim is to provide the best healthcare with minimum expenditures. So they have to be really concerned about cutting down the healthcare expenditures. May it be the simple IV cannula, may it be the gauze, or may it be syringes, tubings, whatever. As patients are concerned to protect ourselves, as patients are concerned to protect themselves legally, we need to legally protect ourselves. We need to practice correctly and keeping in mind the proper record keeping system. This is important. And we have to work within the protocol. We have to work within the standard also, and a clear system of recording and reporting that is transparent. So many a time we see that we always try to protect us, protect our institution, protect our colleagues in the legal house, but we try to, we should not forget the concept of patient advocacy here. So this is important. And from Ms. Mary, we have learned medication strategy, like patient cannot take medication or any procedure, they cannot perform. So we cannot expect that they are going to perform at the best way, like may it be the simple NG-tube feeding or may it be the simple. We have to teach them right from the beginning. So right at the time of admission only, we should concentrate and we should explain them the procedure, what they can expect later, and how. That means altogether for my students, I feel that we have to concern not only about the clinical scenario, they have to prepare themselves for diverse working scenarios, including home care and discharge, everything. So each procedure need to be explained to the patient, and we have to teach right from the beginning. So these are the few points that I have noted for my students.
That's wonderful, Bhavani, to hear you. And thank you so much. As your teacher, I have given you done further questions so that you can teach your students and whoever is here, and they will be also benefited. And now the
Thank you, ma'am.
discussion is open for a participant. Any questions to the members, to our experts? Any questions? We already have completed on time, 2 p.m. Any question? Miss Vinci, if you want to say anything, add anything, comment anything, our National Secretary, are you there?
I'm here very much.
Yeah.
Just 1 minute.
Looking forward to hear something from you, and as the questions are coming up.
Thank you, our eminent delegates who have graced this occasion and kickstarting of our 2024 Empower Hour, and also Unmona, Dr. Ranju and team who has done a wonderful job of coordinating. And each and every line was precious given by all the delegates. I'm sure our people who are logged in here are taking a very enriching experience from here, and also will look forward to more of these kind of things coming up with Annie. Actually, Annie being basic, we all are nurses, we are more oriented about patient safety, but Annie leaders are more focused and oriented towards patient safety. We take it very seriously. And that's it. Thank you so much for a wonderful session, and we are looking forward to many more.
Thank you, Vinci. So the slide.
Thank you.
So as we are coming to the end, Dr. Das, do you like to say anything?
Yeah, it has been a very informative session. I have learned a lot from all the dignitaries here who have contributed so lot to this program. I cannot emphasize more that the safety of the patient is of utmost importance. So in our surgical practice, we have some definitive guidelines, like we have a WHO checklist. So that patient has to be identified on the bed itself. And then when the patient is again shifted to the OT, there are some things that are to be checked by the sister. There are some things that are to be checked by the anesthetist team before they intubate or even shift the patient to from the recovery room to the OT. And then before we start a surgery, we always again further identify what is the name of the patient, what is his disease, what is the operation that we are going to do. And if all the sisters have a very important role to play, that the safety checklist about all the instruments, all the equipments. Nowadays, a lot of instruments we use in our OTs. So those are that has to be checked very well. And we always put a documentation of that these are checked and there's a tick mark. Sisters give it a tick mark, the anesthetist gives a tick mark, how much of anticipated blood loss we have for this surgery. And of course, all these things are to be explained to the patient and the patient's party, and a written consent in their own language, understandable to them, is mandatory.
Yes.
Okay.
Thank you so much for highlighting once again. As I'm coming to the end of the discussion, I'll quickly run through 2-3 slides that is just for take-home message. And when we are talking to the doctor, talking to the patient, when they are coming to the doctor, we must say that jot down your symptoms in detail, take your previous prescriptions, carry your latest test report, current medication list, inform any allergies or relevant family history, prepare your questions, take along a caregiver. So these are the things, if we say in advance, that next slide, say in advance, that will be good. There was a time when I was so young, went to doctor, I was expecting doctor will know anything. If I don't talk also anything, doctor will know. Then doctor asks, she cannot talk or what, like that. I was thinking, you see me and you identify, but it is not. We have to get ready and we have to know about. And also, as a responsible patient, we have to ask them, they should have some place that actively participate in my own healthcare journey, provide my complete, accurate and honest medical history, comply with the prescribed treatment plan, medication and follow-up review, respect the rights and well-being of healthcare providers and fellow patients, understand and fulfill my financial obligation, follow healthy lifestyle practices. Sometimes we have to also, I have seen in the, next slide, I have seen in the Singapore hospital that you cannot, patients, they're writing to the patient, you cannot blame us. Customer, if you're seeing something wrong, you tell us that how to do. But many times, next slide, many times we are like, we are in the position that we have to become victim in front of the patient. Okay, then that we also have to take some place as a healthcare provider, so that we'll create the safety to the patients. So with this, I am almost coming to the end. Next, this slide I'm not reading in detail because time is very short. So I just would like to mention over here, next Empower Hour will be on the 23rd February 2024. That is by the Punjab chapter. So that's all about. So thank you. I would like to request Madam Ajita, if she is here, to say any comments. And if there is any questions, still the members are experts are here. They are ready to answer. Ma'am Ajita, do you have?
Thank you very much, Dr. Unmona, for taking lead for such a program. It has been so much enriching. I'm sure next time we had a little bit of an issue with the participants. I could have done that before, but
Yes, ma'am.
I'll do that right away to more number of people. Yeah, because my WhatsApp is flooded with a lot of queries and messages. Thank you so much, Dr. Gunabi Das, despite your busy schedule, coming to us, and I don't know whether the rest of the people are late, but it's very encouraging. I heard that. Dr. Momi Niyog, I heard that. I heard that on screen. But anyways, pleasure to have you. And one of our mission is to associate with many other professional organizations this year. We had been doing it, but we will concentrate on that this year more, so that the cumulative effect of all our efforts would be much better if we are able to connect with others and do whatever we can. So I'm even visiting the IMA headquarters for this. To connect with more doctors. It's very important whatever we do.
Exactly.
The mistakes which has been already committed by sidelining doctors. Sometimes I felt that too. A lot of quality things are happening, but hardly any doctors in that, and it won't reach anywhere if doctors don't come into the mainstream and talk about their problems. And I guess the future
vice
is
versa also, madam. We also expect you people also to come into our platforms also.
Sure.
And to speak forward whatever, because you are the backbone actually of the whole healthcare. So the ground realities are actually faced by the sisters.
Yes. So that's what on the card is, that we will associate with our fellow doctors more, and help them to get into the mainstream of quality, and not someone who will be questioned by a group of quality people. No, not really. So you will have to take the mantle. That is what we believe in. And thank you so very much for sparing your time, your willingness. Sincerely appreciate to come along with us. And this is not the last one. We'll reach out to you again for more. And I guess the other people. Everybody has. I mean, this is a busy time, working time for everyone. But thanks a lot. Thank you, Dr. Unmona. Wonderful show.
Thank you, ma'am.
We'll expect.
It was a challenge for me.
Thank you.
Also.
Thank you.
Yeah. Yes,
Ranju, you want to say anything? Chapter head.
Yes, ma'am. So we are almost coming to the end of today's talk show. I thank you, Madam Dr. Unmona Porkahai Saikia, and the panelists for a fruitful discussion on engaging patient to prevent harm. I also express my gratitude to Madam Ajita Nair and national officials ANI for giving us this opportunity to start the first episode of Empower Hour, and also for your presence and support. I convey my gratitude to all the panelists for joining us in spite of their busy schedule and for your valuable inputs in today's talk show. I express my gratitude to all the participants and ANA member for your presence. At last, not the least, I thank the officials and members of Northeast Chapter for your support and also cooperation. Once again, thank you all. Long live NEI.
Thank you.
Thank you, everybody. Thank you so much.
Thank you.